And thanks for making it to Veterans Info Tap. I'm glad you made it. A while back, there's been a couple times where I had talked about the VA wanting to drastically cut the amount they would be willing to pay for ambulatory services. And this would radically disrupt care for veterans, especially in rural areas. I followed that up with some information from the Senate Veterans Affairs Committee, basically pushing on the VA to not implement that rule change. And it just happened to see another article pop up on this and wanted to share it with you here today. Please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. Every thumbs up and every minute watched helps to push this into the hands of our brothers and sisters who need it. If you want to support the channel in other ways, consider being a member. You can do that by going to the homepage. You'll see the highlighted members and a join button. Thank you so much to all you members. All right, so the headline is VA delays rule change on how it pays veterans air ambulance services. So, didn't say they're never going to do it. It just says delays. VA delays rule change on how it pays veterans air ambulance service. This just came out September 9th, 2024. I'm sharing it with you here today. All right, Veterans Affairs. I found this on Military Times, by the way, militarytimes.com, and jumping into it here. Veterans Affairs leaders have agreed to delay rule changes on specialty ambulance reimbursements until 2029. A win for advocates who warned that new policies could severely impact emergency services for veterans living in rural areas. Before Friday's announcement, the new rules were set to go into effect next February. Industry officials and department planners have sparred for years over the change, which would in many cases reduce the amount VA pays to air ambulance firms after those companies transport patients. In a joint statement, Senate Veterans Affairs Committee Chairman Jon Tester and Ranking Member Moran praised the VA decision. Both lawmakers have worked to stop the rule change, arguing that any plan that could hurt those ambulance services should be reconsidered. Emergency air and ground transportation services in Montana and rural America can be the difference between life and death, Tester said. VA's rushed rollout of its rate change for these services could have been the final straw for providers serving rural America. And I'm glad to see VA answering our call to fix this issue. Last fall, during a speech at the National Press Club, VA Secretary Dennis McDonough pushed back on accusations that the rule change was a money-saving move. He insisted the federal regulations require ambulance providers to have a contract with the department or receive reimbursements at a rate set by Medicare, often lower than what they currently charge. A 2018 report from the VA Inspector General found that 227,000 specialty medical transportation invoices over a 15-month period. So think about that for a minute. In 15 months, 227,000 veterans received specialty medical transportation. 227,000 in a 15-month period. About 20% were not properly authorized. Investigators estimated that the department awarded more than $20 million in improper payments annually. But industry representatives have pushed back on that assertion, pointing to the unique costs and challenges associated with moving critically ill or injured patients in rural areas. In a statement, Ben Clayton, Chief Executive Officer of Life Flight Network, said the delay will allow time for us to work together on a permanent solution while ensuring veterans maintain access to these critical life-saving emergency services. Congress had already intervened to delay the reimbursement rule change last year, including language in a budget bill last year to push back the implementation timeline from early 2024 to 2025. Now, lawmakers will have several more years to negotiate a compromise between the emergency response firms and VA administrators. With that, that concludes this portion. I did want to jump over to another topic that's kind of dovetails into this, and that would be emergency care. I pulled up on the VA's website information on emergency care. I'm just going to read this directly from their site just to bring it to your awareness, because if you're in an ambulance for any type of ambulatory service, chances are you're going to an emergency room. So, what to know if you go to a non-VA facility for emergency care. The facility must be an emergency department. Okay, that's probably going to happen in that case. So it says here, and this is from the VA's website, we can only cover the cost of emergency care at an emergency department. An emergency department is a facility that has the staff and equipment to provide emergency care, like a hospital or freestanding emergency department. Urgent care facilities don't qualify as emergency departments. If you're not sure what type of facility you should go to, the VA can help. Now, chances are, again, you're probably headed to an emergency room. So we must get notified. This is important. We, the VA, must get notified of your care within 72 hours. Ask the provider to notify us right away in either of these ways: through our VA Emergency Care Reporting Portal, or by calling us at 844-724-7842. Now, what I do is I suggest take your VA ID card and put a little sticky on the back of it or whatever with that phone number, and have that in your wallet, and put a little note: call within 72 hours of emergency care on there. And you'll always have that phone number. And if you are incapacitated for some reason, and the staff goes through your wallet to figure out who you are, they see, oh, VA, okay, you got VA care. Oh, what's this note? Call 72 hours. Hopefully that prompts them to call. We must, this is the VA's website saying this, we must get notification within 72 hours, and 72 hours is in bold. 72 hours of when your emergency care starts. We prefer that the provider notify us, but if they don't, you or a loved one, right, chances, or someone, you or someone acting on your behalf can notify us instead. We can only cover emergency care when you meet certain requirements. Keep reading to learn more about eligibility requirements and emergency mental health care and other types of emergency care. It goes on a little bit more. I'll go ahead and just read some of this for you. Eligibility for emergency mental health care in most cases will provide or cover the cost of your emergency mental health care and up to 90 days of related services, even if you're not enrolled in VA health care. The next one, eligibility for all other emergency care, general eligibility requirements. By law, we can only cover the cost of your care at a non-VA emergency department if you meet all of these requirements. There's 4 bullet points. You are enrolled in VA healthcare, or you have a qualifying exemption from enrollment, and a VA healthcare facility or other facility that could provide the needed care wasn't feasibly available, meaning it was too far away for you to get there fast enough to get your emergency care that you needed. And a person with an average knowledge of health and medicine, called a prudent layperson, would reasonably believe that a delay in seeking care would put you in life or health, or put your life or health in danger. Last bullet: you meet our other requirements based on your specific situation, including the time limit for us to receive your claim. Keep reading to learn more about requirements for different situations. Bottom line is that there's more information on here, but just wanted to float that out there. Mainly the 72-hour aspect. If you're in an ambulance, any sort of ambulatory care, and you go to an emergency room, you need to notify, or your loved one needs to notify, or the hospital needs to notify. Somebody needs to notify the VA within 72 hours. With that, thank you so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.